With the pandemic, we have seen a decline in people who are coming to the emergency department. So much fewer people, about 40% fewer people who are presenting with chest pain in March as compared to all the preceding months. And also a fewer number of heart attacks. And we are actually getting worried because we are afraid whether these patients are staying home with heart attacks or not. Heart attack can present in many different ways. However, the most common symptom of heart attack is some discomfort in their chest, shortness of breath, cold sweats. That's probably the most common presentation of it. If somebody's feeling that they're having a heart attack, we recommend call 911, come to the emergency department, let us check you out. If you're having symptoms that have been ongoing for a while, or you're having it in the sitting of fever and cough and you don't think it's a heart attack, at least call your doctor to understand what's happening and to make sure that it's not something that's dangerous or worrisome. We have many protocols that have been put in place in the emergency department, both from protective equipment as well as all the protocols like where the patient is being placed. And that is both to protect the patients who are coming in because we don't want transmission between patients, and also to protect the staff.
We've made the observation that there are less stroke patients coming to the hospital, and this has been happening over probably the last month or so. We think that a lot of the patients that have significant impairments are getting to the hospital, but those with minor symptoms may not be calling 911 and not be acknowledging that they have to go to the emergency room to get evaluated and treated promptly. We think this may have to do with the fact that minor symptoms of stroke may not cause major impairment. Minor symptoms may go unnoticed, especially with patients in isolation that may be home alone and not around others. Some of the minor symptoms may be slurring of speech, tingling or numbness on one side of the body. It may be someone who just has transient symptoms who fully recovers. That's termed as a transient ischemic attack, which signifies that patient symptoms have resolved. But that's a warning sign for potentially major things to come. Someone who has those types of symptoms can have a major stroke within the next 48 hours. And it's those patients that often need urgent evaluation and attention. If you're having symptoms, irrespective of minor or major symptoms, that you treat it as a neurological emergency, call 911 and get to the hospital as soon as possible. And please know that if you do come to the emergency department, that we'll evaluate you in a safe way to protect you and the practitioners that treat you.